Okay, well, thank you everyone for joining us tonight. I am Jen Maduka with the American Cancer Society, and thank you all for joining us today for the session 3 of the Train to Trainer series in partnership with the California, Hawaii, and NAACP. Today's session will focus on access to care. Coping with cancer can be an immense and complicated burden. The reality of cancer is that many patients, especially those with limited resources, must overcome numerous hurdles to access timely, high-quality cancer care. Whether it is quality health insurance coverage, transportation, navigating the system, access directly affects and impacts your quality of life. Today's panelists will dive in deeper and give some insight on ways we are trying to close the access gap. First, we have Autumn Ogden-Smith with ACS CAN. She joined CAN in 2015 as California State Legislative Director. Autumn brings more than 15 years of experience in the California legislature as a policy analyst for a local nonprofit, California Coverage and Health Initiatives, and as the Director of State Legislation for ACS CAN. Her combined experience includes healthcare, human service issues ranging from access to quality care, disease prevention, and affordability. Welcome, Autumn. Unfortunately, Bryce was unable to join us tonight, but I still wanted to highlight the amazing work of Every Table. For those who don't know about Every Table, it originally started as a concept to bring healthy grab-and-go food to lower-income communities at an affordable price. Today, they have expanded to include locations throughout Southern California, Arizona, and New York. Chefs at their local kitchens turn fresh, wholesome ingredients into delicious meals, which they sell through their small grab-and-go storefronts. From start to finish, everything is designed to be super efficient, and savings are reflected in their prices. They have locations in food deserts, underserved communities with little or no access to nutritious food, and in affluent areas to ensure that they are trying to keep things affordable based on where people live. The prices are you can kind of say that they are based on a sliding scale based on the neighborhoods that they serve. And we also have Pastor Rhonda. Rhonda served for over 25 years as the Director of Special Projects for the Los Angeles Urban League, where she collaborated with business community leaders to form LA Collaborative. She also facilitated and led business development, learning, managing, and implementation of new business opportunities, in addition to facilitating educational workshops and programs. She is also a breast cancer survivor, which led her to launch Celebrate Life Cancer Ministry after completing treatment. Acting as moderator and leading today's discussion is Rhonda Smith. Rhonda currently serves as the Executive Director of the California Black Health Network. Rhonda has extensive experience working in the health equity space with leadership roles that have included LifeServe Youth Foundation, Underserved, Live Healthy OC Initiative, and also served as the consultant / statewide project manager for the Susan G. Komen Circle of Promise California Initiative, an extensive 4-year effort to identify evidence-based strategies to decrease the high mortality rate of African-American women diagnosed with breast cancer and address disparities at the system, community, and individual levels. She also in 2012 served as the Mission Integration Chair for the American Cancer Society's Making Strides Against Breast Cancer Walk. Thank you all for joining us today. And with that, I will turn it over to Rhonda. But first, I will stop sharing my screen so you can see all of our faces. You are muted, Rhonda.
Yes, I knew I was going to do that. I was just saying thank you for the opportunity to be with you all tonight. It's always great to see my a partner in crime, my R squared over there, and Autumn, good to see you again. And so we are going to be talking about access to care tonight from different perspectives. It's unfortunate that Bryce couldn't be here. I would be really interested in hearing what he has to say about the food insecurity and being in food deserts. Just a few housekeeping things before we get started. Everybody will remain on mute. If you have any questions throughout the duration of the discussion tonight, please make sure you put them in the Q&A box, not the chat. But if you see someone that you know on the call today, you can say hello, give a shout out, and have some commentary going there. But please make sure you put your Q&A, your questions in the Q&A box. And so I will get started and I will share my screen. Okay, so I will sort of give an intro to access to care and talk about some of the things that are contributing to that. And also, what is the state of Black health when we think about cancer? And then what are some of the things that we deal with in terms of barriers or access to care for the Black community? And I'll talk a little bit about what California Black Health Network is doing to improve access to care for the folks that we work with. And so just a bit about the California Black Health Network, in case some of you on the call may not be familiar with us, but we've been around for almost 40 years. We're the voice and trusted resource for Black health equity in California, and we are the only Black-led statewide organization that is dedicated to advancing health equity for all African Americans and Black immigrants here in the state. And so I wanted to start by sharing just some information from the American Cancer Society. So every year, the ACS publishes what they call cancer facts and figures. And so this is for the entire country, not just for California. I felt it was important just to give some highlights here. And generally speaking, based on the most recent data, lung cancer is the second most diagnosed cancer in the Black community. And then when we think about other types of cancers like prostate cancer, late-stage prostate cancer diagnosis is actually increasing in Black men. And we're seeing some decline in terms of the prostate mortality rate. Breast cancer, another hormonal type of cancer, has surpassed lung cancer as the leading cause of cancer deaths in Black women. And we'll get into a bit more details about some of the disparities related to that as well. And we know that in terms of access to care, there are a lot of different things that create barriers to access. One of them is systemic racism, and that has a significant impact on health outcomes, unfortunately, and ultimately health disparities. So because of the system and structural barriers and behaviors and individual mindset and bias that exists within the system, it has increased risk to exposure for individuals seeking care. And we'll talk a little bit about how that even works when we look at the Medi-Cal population versus the private population, or those who are privately insured. Autumn's going to talk about some things that are in the pipeline on a policy standpoint that actually addresses some of the disparities as it relates to those on Medi-Cal. And in terms of the state of Black health as it relates to cancer, we know that during COVID, we saw a decline overall in cancer screenings just because people were not getting out and about and going to regular appointments or doing anything much in person. And so this data is a few years old. We haven't seen the most recent data that incorporates what happened during COVID, but we see just in general more parity or more balance between what we see in terms of screening rates when this was created compared to other populations or other race and ethnic groups. So not much of a disparity there. That has improved over the last decade or so. But when we look at cancer incidence rates, we see that there's definitely a difference when it comes to breast cancer, as I mentioned in the previous slide. We see a rate of breast cancer here. We talk about incidence rate, a little bit lower when we compare it to white women. When we look at prostate cancer in men, we see a significantly higher incidence rate. That means the diagnosis rate is a lot higher, significantly higher for Black men when it comes to prostate cancer compared to white men and other race and ethnic groups. And so when we think about, okay, there's screening and then there's the diagnosis, and we know that early diagnosis is the key to survival. We see some not much difference here when it comes to especially breast cancer and white women. We've seen a lot more parity over the last few years when it comes to incidence rate and early diagnosis, but we see differences when we look at the outcomes and death rates for Black women compared to white women and other race and ethnic groups. So we see that here when we look at breast cancer outcomes or deaths, there's about a 24% difference here based on the data from 2017, but we know in general that breast cancer outcomes vary by about 41% or so when we look at disparities and death rate related to Black women compared to white women. When we look at cervical cancer, still a higher death rate in the Black community, colorectal cancer, a higher death rate. And we know that we're seeing a lot younger age groups being diagnosed with colorectal cancer over the last 5 years or so. You know, all of us are familiar with Chadwick Boseman, and I'm sure Rhonda can make some commentary about her experience dealing with his doctor and knowing that his death didn't really have to happen. And if we were much more aware of what the trends have been when it comes to different race and ethnic groups and cancer diagnosis, then probably we could have prevented his death. And also looking at lung cancer, we have a higher mortality rate or death rate. And as I talked about before, prostate cancer when it comes to Black men compared to white men. So here we see Black men dying at a rate that's almost twice as much as white men. And so we have to make sure that we get our Black men out to get prostate cancer screening, and definitely when they're in their 40s. I think Rhonda will talk about that maybe a little bit as we go along, perhaps, maybe. And so when we think about some of the reasons why we see these disparities, access to care obviously is one of the reasons. I apologize for my little one in the background. She would rather be outside than inside right now. So she's envious of some other dogs that are out there playing, and she's not. Sorry about that. So when we look at health insurance, you know, that is sort of the starting point when we talk about access to care. So if we don't have health insurance coverage, then, you know, it limits us in terms of healthcare services and resources that we could have access to. So for the Black community, we see that we have a comparable to the state average when it comes to employee-based or employer-based insurance. Medi-Cal, the second highest insurance rate when we compare to the Latin population. And so overall, we have seen an increase in insured Blacks here in California, but we're still seeing disparity when it comes to health outcomes. So again, why is that still happening? So type of health insurance can often dictate outcomes too. I talked a little bit in the beginning about the difference between what happens with someone in Medi-Cal when it comes to cancer diagnosis, cancer treatment, and access to care. And timeliness to care can be very different than what happens with someone who has employer-based insurance or even definitely private insurance. So it shouldn't be that way, but the reimbursement rates sometimes drive decisions, and the system and how efficient it is often contributes to that too. So there is some legislation that I mentioned earlier that Autumn will talk about that addresses that issue, and then it is intended to improve access for Medi-Cal patients, getting access to clinical trials, getting access to treatment at NCI designated cancer centers here in California. Also underlying social and economic inequities. We know the disparity when it comes to wealth and income in the Black community compared to the white community. Under-resourced communities, there's often not just food deserts, but also medical deserts and lack of access to a treatment center, often is the case when we look at certain communities that are under-resourced. Underrepresentation in the development of screening guidelines, and also when it comes to clinical trials. So if we're not involved in or participate in clinical trials, then when drugs come into market or commercially available, we don't really have the evidence to prove that those drugs will be very effective in treating the type of cancer that we have. Triple negative breast cancer is one example of that, where we haven't seen the development of a lot of drugs that are specifically targeted for triple negative, but there are some drugs in the pipeline. So hopefully we'll see more diverse participation and more participation of Black women in clinical trials for that, so that we can make sure that we get the right drugs that work for our women when they get diagnosed with triple negative. And then beyond healthcare coverage and access to care, discrimination and bias, we know, I think some of us may have experienced that when we're trying to navigate through the healthcare system. Unfortunately, that's a reality that we have to face and deal with when we're seeking healthcare. And so generally speaking, Black people are more likely than white people to face barriers when we talk about access to care, not just cancer care, but care in general. We see that when we talk about what people experience because of their race and ethnicity, that Black people experience that being treated unfairly twice the rate, or actually 4 times the rate as white people do. So there are a lot of different factors that contribute to poor outcomes for when we look at the Black community for cancer outcomes and other health disparities. And it's a complicated issue, but we're working every day to try to affect some change around that. So for the California Black Health Network, we launched the Campaign for Black Health Equity, which is a multi-year campaign, not just to raise money because we're a nonprofit, but also to really try to drive change around what's happening in health disparities. So really decrease health disparities and improve life expectancy of Black Californians. Right now, Blacks live about 5.5 years less than the state average. When you look at other race and ethnic groups, that could be up to a 7-year gap. And we know that because of COVID, that gap has even widened, but the data is a little bit in a lag time. So we haven't seen that data published yet, but we know that has happened. And we know across the rest of the country, it has widened the gap in terms of life expectancy about 1 to 2 years, in some cases, even 3 years. We are working to also drive growth and capacity building amongst grassroots partners. We have a Black Health Network that is a virtual community where people can come together and connect, collaborate, and communicate and do some virtual networking. And so we have leaders from community-based organizations that we will be working with to support leadership development and capacity building for them so that they can have a greater impact at the grassroots level. We will engage in advocacy initiatives. We've been working with Autumn and a group of other folks, again, on the cancer bill that addresses the issues for Medi-Cal populations. And so we are focusing more on addressing policy initiatives at the system level. So there have been quite a few policy changes and legislation that's been passed to really open up access for, I should say, people at the individual level as well as within the communities, but we are still seeing health disparities happen. And so I think until we actually start to see things change at the system level, we will still continue to talk about health disparities and experience that. And so we also are launching education initiatives to improve the health literacy of healthcare professionals as well as individuals and patients. At the end of the road, we hope to create a more empowered community of Black people here in California that are really proactive about their health and wellness and take ownership of that so that we can begin to close the gap and play a role in creating a healthier community. And also for healthcare professionals too, we want to make sure that we're addressing health literacy on both sides of the patient-provider relationship and do our part to help improve cultural competency of professionals, healthcare professionals, and ensure that they engage in more cultural humility when they're dealing with patients that don't look like them or don't have the same life and lived experiences. And so there are 6 main components of the Campaign for Black Health Equity. There's the Black Health Agenda, which will be a statewide strategy and plan to address health disparities. We're doing that in 10 counties across California. We will leave with each county their own mini version of a Black Health Agenda that they can implement, and that is more germane to the issues that they're dealing with in their communities and really empowering people to participate in that process and engaging the community around that. We created the Black Health Network that I mentioned just a few minutes ago. Some of you on the call may have attended one of our health equity forums, but that's a speaker series where we showcase some subject matter expert or notable person in health disparities, health literacy, health disparities or public health. We have the Health for Life series, which is our education initiative to improve health literacy. We engage in a lot of policy and advocacy work, and again, to really dismantle some of those barriers that exist at the system level. And we also are Cover California navigators. So we are certified to enroll people into healthcare coverage. So again, that's kind of the starting point, making sure they have access to what they basically need in terms of accessing healthcare. And I invite you to join us in the campaign for Black Health Equity. You can visit our website at cablackhealthnetwork.org, or you can join us on social media. Most of our social media handles are at YourCBHN. We're also on Instagram, same at YourCBHN. So hopefully you'll join us and attend some of our events. And if you have any questions, we can ask those now, but I will stop sharing my screen.
So we did have a couple of questions. So one is from Jeanette. She said that I live in Pomona, California. Where can I find the nearest Black Health Network facility?
So I wish we are a statewide organization, but we don't have physical offices across the state. Right now, we have an office in Sacramento. Pomona is close to LA, that's right. I'm not from California, but it's close to LA, correct?
It's in LA County, yeah.
It's in LA County. Yes, so I am based in LA. We have a person in Long Beach. So if you're interested in getting connected to what we're doing, Jen's going to follow up with some information after this is over. She's welcome to share my contact info and happy to have a conversation if you'd like to connect.
Great. And Raquel has, how can we find out which 10 counties have the Black Health Agenda work?
Yes, so you can visit our website. If you go to the tab that says resources, in the drop-down menu, you'll see a tab for the Black Health Agenda. And so everything that you need to know about the Black Health Agenda, what 10 counties we're going to, what we've actually done so far. We've done San Joaquin County, so there's a report on the website that you can download and take a look at. On August the 11th, we're actually starting the Black Health Agenda work in Sacramento. There's information on the website too under our events tab if you're interested in attending, even though you don't live in Sacramento, but you're welcome to attend. But if you have folks that you know that live in the Sacramento area, please share the information with them.
Great. And I think that's the end for questions right now. So we can move on.
Great. And so next up is Pastor Rhonda. She is my partner in crime. Often we haven't done any good trouble in a long time. So I think we're overdue for some good trouble. So without further ado, I'll turn it over to Pastor Rhonda to talk about patient navigation and how that works in the cancer space.
Awesome. Thank you, Rhonda Squared. And thank you for having me here today. Let me begin by telling you a little bit about Celebrate Life Cancer Ministry. It is an organization that I launched 20 years ago as a result of my personal experience with breast cancer. Inflammatory breast cancer, in fact, is what I was diagnosed with at the age of 40. And it was stage 3B and extremely aggressive. And I ended up experiencing a surgery. I had a lumpectomy, 6 rounds of chemotherapy, a mastectomy, 4 more rounds of chemotherapy, and then 25 days of radiation. Why is it important that I tell you that? I've been through some things. And just to let you know that the things that I experienced and the things that I experienced with other people helped me to provide the best possible services through Celebrate Life Cancer Ministry. And as things have changed over time, we have been able to expand our services to include those adjustments as well. As an organization, Celebrate Life Cancer Ministry provides home and hospital visitation, treatment buddies, telephone buddies, hospice support. We host support group meetings, and sometimes there's just one a month, but depending on how the need arises, we can and have incorporated additional sessions as well. We have exercise classes, line dance classes, physical, in-person line dance classes. We have Zoom exercise classes, chair exercise that individuals can do at their own pace. And then we have Shepherd's Manor. Shepherd's Manor is a day stay for individuals who have been touched by cancer and their caregivers. It's an opportunity for them to step away from their own environment and come to an environment that is conducive for healing. Not to say that home isn't, but sometimes they just want to be around individuals who know and understand and care from a different level. I've been told time and time again, my family is great, but they just don't understand what we're going through. So it's an opportunity for the individuals to come by and and I kind of put a twist on it, like a Starbucks for cancer survivors and caregivers. Uh, and then Celebrate Life does provide patient navigation services. And what's very key is in the process of doing patient navigation, it's important that we understand what our limitations are. And where we fall short sometimes is serving the individuals who are bilingual or monolingual Spanish. And it's at that point that we reach out in a great way to USC Norris Comprehensive Cancer Center to provide that support to the individuals who call. And it's amazing. Now, I don't speak Spanish, but I know enough to communicate with them to be able to say, hold on just a moment, get your information, and get that information sent over to a dear partner, Dr. Jasemi Lopez. And the two of us in doing patient navigation have literally been an example of what true patient navigation can look like. An example was one individual had just been released from jail, was diagnosed with cancer on the inside in the prison system, was told that they were connected with the California health system and tried to get his cancer service back on track. Well, when he went to his first appointment, he did not have an appointment. They did not have him in the system. He was nowhere. But I was able to pick up the phone, contact Dr. Lopez, and together, we not only were we able to get him service, but we were able to get him service connected to an individual with a name and a phone number. And that individual went to the appointment. They were served. They followed up, and that's what true patient navigation looks like, even in a collaborative effort. So then the question becomes, so what is this patient navigation stuff? Well, patient navigation was actually spearheaded by Harold P. Freeman, located in New York, where back in 1990, he started the Patient Navigation Institute for the purpose of eliminating barriers to timely screening, diagnosis, treatment, and supportive care. It has since evolved to include timely movement of an individual across the entire healthcare continuum for prevention, detection, diagnosis, treatment, and supportive and to end of life care. So it's truly a complete circle of the kind of support that individuals need going through their cancer journey. So basically, patient navigation is providing whatever services are needed for a patient to be able to go from to stay on track, to go from healing through their treatment regimen all the way through the end of their care, whatever that means. And there are 4 main categories that should be considered with patient navigation, according to Harold P. Freeman Patient Navigation Institute. And they are outreach, which is helping individuals get screened for care, patient care, which is those in the journey, in the process, anywhere in that process, survivorship, indicating that they have completed the initial patient care, but yet there are still a number of resources and actually life occurrences that happen even in survivorship. A lot of people think that because you're finished with treatment, you're finished with the journey, and that's not always true. And then a very strong component is the financial component. So whether that's insurance or just being able to maintain your financial livelihood, your basic needs from rent to utilities to food, whatever that is, those individuals begin to fall into the financial aspect as well. So speaking more about navigation through the healthcare system, the key is to equip and empower patients to advocate for themselves. Far too often, individuals hear the diagnosis and they're like, I can't deal with this. They stop thinking. Some of them go behind closed doors and they stay there. They only come out to go to a doctor's appointment. And we hope that they're truly going to their doctor's appointment. But once they are able to have someone to navigate for them, and that navigation can look like a triangle where it's the patient and the navigator communicating with the healthcare system, or if it's just the patient and the healthcare system. Whichever way it is whatever way is best for the patient. And depending on what their needs are, because everyone has a different set of needs at different portions of the journey. So, but whatever those needs are, providing them with the questions to ask so that they can begin to understand. A lot of times, it even includes helping them and their families to understand the journey so that they're not as fearful as they could be with a diagnosis of with those famous 4 words, you have cancer. And then another is recognizing the resources that, where do you get the resources? Where do they come from that will allow the individual to get what it is that they need? And many people they don't know. And that's a huge thing in the African American community. Some of us don't really go to the doctor the way we should. And if we do go, we don't know what services are available through our healthcare system. And so one thing to know is that the social worker or the oncology social worker is a very key person within the cancer the spectrum. They have quite a bit of information, whether it's handouts, whether it's connections, making the right connections to individuals so that they can continue to be on the journey. Another would be to connect with a cancer support group or even faith-based organizations. And some people say, you know what? The people around me are my team. So to be able to educate their team and empower them to share with their team so that they can gather their own circle and be beneficial along that path. And even over the years, there have been new resources that have come along. And as needs change, it is up to the patient navigator to continue to find new resources to provide them as they're needed with different individuals. I have over time heard people say, well, you didn't tell me that information, and you didn't tell me this, and you didn't tell me that. And it's like, but you didn't cross that bridge already. As a navigator, there are things that we need to, well, as they say, know when to hold them, know when to fold them. So if you're not, if you were just diagnosed with cancer, I don't need to have conversations with you that have to do with lymphedema. We would talk about lymphedema after you had surgery and lymph nodes were removed. If lymph nodes weren't removed, that may not be a part of the conversation that comes up. So we just need to understand that everyone's situation is different and everyone's line of resources are different as well. Another component is the resources that change and are modified based on the stage of cancer. I've experienced a number of individuals with stage 4 cancer. And it's interesting that they don't necessarily, or the doctors have not informed them that basically, that most often stage 4 is equivalent to metastatic cancer. And when that is the case, then we need to have a different set of conversation that begins to include clinical trials, that begins to include options and being able to find additional resources in a whole different direction, and along the line of clinical trials and new treatments that have already come out that they might be able to consult with their doctor to see how that might fit in their world. One of the challenges that I have seen among African Americans is a lot of them just simply lack knowledge of what resources are available to them and what is out there. And it's our responsibility to make sure they are empowered and at least know where to go when they don't know what to do. I can't say that enough. Know where to go when you don't know what to do. And as that occurs, then they begin to realize that there are healthcare professionals, there are experts in the field, there are navigators out there. Some people, the navigators are called care ambassadors, and whatever the name is, it's the population of experts that are able to help direct you. And sometimes it's not one organization that knows all of it, but it's an organization that's able to effectively collaborate with other individuals to allow it to go smoothly for that individual. Like this morning, I received a phone call from someone who is looking for financial support for someone who is actually lives in Texas. Well, the resources that I have are not necessarily for individuals in the Texas area. However, we do pick customer service is key. Pick up the phone, call Texas, call American Cancer Society in Texas, find out what resources are there, and come back with a name to connect them with. Because when a person is going through the cancer journey, when they're in treatment, when they're in care, when they have 50 million doctor's appointments, the last thing they need to do is be on a hunt of resources and researching and sitting on the phone and only to be transferred to 11,000 people to find out that that organization doesn't help individuals in Texas. All that work should be done by a patient navigator. And that customer service then relay back to the patient and say, here's the call you need to make. They do provide services for people like you in your situation. And these are the guidelines, even if you're able to find that out, to make sure they qualify even before they call and then move the needle forward. As we talk about disparity of services, what I find to be interesting, and I really am going to walk gingerly on this topic. But what I find to be interesting is that the healthcare professionals that I know went into that line of work to help people. But the systems that are in place have caused even frustration unto them, and they are then obligated to follow the system. With that in mind, we have healthcare professionals that want to do better and to help to close the gap of the disparities that are going on. And so I just want to encourage them to continue to do what they can do to help help patients stay on the path to continuum health, and don't allow their heart to be so broken that they simply ease into what the system says and define ways to work the system while helping the people. Thank you.
Thank you. Thank you so much.
Yeah. Yeah, thank you. So I have some questions we don't have any questions in the chat, but I have some questions for Pastor Rhonda, if you don't mind. Yeah, and so, you know, I have heard those dreaded words too, you have cancer, and I know what it feels like to be on the receiving end of that. I was fortunate enough to have a friend who had been through a breast cancer journey, not herself, but with her mom. So she was there to help me. And patient navigation wasn't something that was really around back then when I got diagnosed. But I guess my question, I have a few questions, but it sounds like asking the question about whether or not there's a patient navigator or a care coach or whatever it's called is probably the first thing you should do after you hear those words or you learn that you have a diagnosis. And just curious about whether or not all cancer centers have that type of resource. And is this something that insurance will cover? Like, how does that all work?
So from my experience, many of them have a oncology nurse and oncology advocate that's available. The challenge is, in many cases, there's one for all of the cancer patients.
Yeah,
that's the problem. However, I'm in the process of of collaborating with one of our local hospitals, and everything is not fleshed out just yet, so I'm going to refrain from the name. But in that, that simple fact, because they're one of the locations that have only one navigator, and they need assistance. So we're going to be able to bring in care ambassadors to walk alongside of them, where they will be able to say, this is, refer their people to us so that we can continue to support them. And of course, it would be up to the people to say, yes, I'm willing to go and to receive this help, but at least say, knowing that that institution is saying, we realize that we need help, and we realize that the people we serve can benefit from the services of Celebrate Life.
Yeah, and so someone in the chat, it wasn't a question, but it was a statement. So all accredited cancer centers have a navigator or navigation services. So I guess that's the same thing as an NCI designated cancer center. And there are, how many are there here in California? I forgot.
That I don't know.
There's 10 NCI designated cancer centers.
Okay. And then USC Norris is one. City of Hope is another. When we look at Southern California, I can't name all of them, but maybe Jen knows, just in case people are curious about, if they have options to go to a cancer center for treatment, should they be diagnosed, or to get a second opinion. Those are the places that you want to go. That generally they have the latest research or access to clinical trials, and generally the most innovative approach to treatment. So I don't know, Jen, if you wanted to comment on that at all.
So in chat, someone responded to that. I can provide some information with the resources after on the accredited NCI centers, but what Michelle.
So it says the accreditation by the Commission on Cancer, or the COC, covers over 500 community cancer centers across the country. not just the NCI designated ones. For example, St. Agnes in Fresno is accredited. So I guess going to the Commission on Cancer's website, they probably have a listing of those 500 cancer centers by state. So that would be a place to go in terms of identifying a potential, should you receive a diagnosis and want to go to an NCI designated cancer center or accredited cancer center, then you'll know which ones in your area are. So thank you for that information, Michelle. Okay, so last but not least, we have Autumn here to share with us some news about what's happening from a policy and legislative standpoint. So take it away.
Thank you. And I'm going to share my screen to show the items that we have been working on over the past several years. My name is Autumn Ogden Smith, and I am the Director of State Government Relations, representing the American Cancer Society Cancer Action Network here in California. Essentially, I'm the in-house lobbyist for ACS-CAN, and I work with the legislature and state departments to support policies that further our mission and the mission of course, ACS. For those of you who don't know, ACS-CAN is the political arm of the American Cancer Society and advocates at the state, federal, and local levels to ensure everybody has access to cancer care and treatment. And in light of what we're discussing today, I wanted to share sort of the mission statement around health equity that the American Cancer Society and Cancer Action and ACS-CAN have. We are strong advocates of health equity and believe that health equity means everyone has a fair and just opportunity to prevent, find, treat, and survive cancer. It requires us to eliminate barriers and address needs to ensure everyone has the same opportunity and be healthy and cancer-free. We acknowledge that people have different circumstances, and because of this, the tools and resources will be different from one person to the next in order to achieve health equity. And today I would like to share with you just a few examples of bills that ACS-CAN California has advocated for around change in cancer care and for disadvantaged communities and communities of color. One of our top priority bills this year is Senate Bill 987. We are co-sponsors with the City of Hope and the California Black Health Network. Senate Bill 987 is the Cancer Care Equity Act. And this bill would enhance Medi-Cal patients' access to the NCI designated comprehensive cancer centers. And there are 10 NCI designated cancer centers, but there's 8 that are comprehensive cancer centers where you can actually go and receive treatment. Although most cancer patients receive quality care in community settings, many patients with complex cancer diagnoses require the expertise of the latest advancements in cancer care to provide the most optimal care, including clinical trials, which play an essential role in the care of cancer patients. Our current one-size-fits-most system prevents too many California cancer patients from accessing optimal care, and too many of our poor and under-resourced Californians do not have access to the care that they need. And to give you, Rhonda Smith provided some excellent examples of the disparities and beautiful charts, but to give a sort of a bigger overview, Medi-Cal currently represents 13 million Californians, and that is 1/3 of all Californians are receiving their care through Medi-Cal, which makes it so critical that we make sure we get it right and that they are receiving the same treatment. As you saw, there are significant disparities in access to care for some cancer patients. The impact of these care disparities can be greater for patients who are Medi-Cal beneficiaries, especially those who come from under-resourced communities. Some Medi-Cal patients do not have access to the appropriate care, which results in them having less than favorable 5-year outcomes. The goal of the Cancer Care Equity Act is to reduce those inequities and ensure that everyone has access to quality care. And again, we really appreciate the work of our partners at the California Black Health Network on this measure, and hope that we can get this through in a meaningful way this year so that more Medi-Cal patients will have access to the same treatments that those with employer-based coverage and Covered California individual coverage have. And another one of our big bills this year, actually, it's one of our biggest priorities. It's a national priority for ACS CAN, and that's Senate Bill 912 by Senator Limon on biomarker testing. And this bill increases access to biomarker testing to ensure that patients receive the right treatment at the right time. Despite advances in biomarker testing, research has shown that there are socioeconomic inequalities in biomarker testing and targeted therapy utilization across cancer types. For example, Black patients are less likely to receive biomarker testing for metastatic non-small cell lung cancer. Older Black or Medicaid insured, which in California is Medi-Cal, insured patients with advanced NSCLC had lower odds of next generation sequencing biomarker testing than patients who were white, younger, or commercially insured. Also, patients who are older, Black, and uninsured or Medi-Cal insured are less likely to be tested for certain guideline indicated biomarkers for colorectal cancer, which results in poor outcomes. Senate Bill 912 will help to close that gap by ensuring that everyone has access to these tests and the appropriate treatments. And I know we're running short on time, so I'm going to follow up with one more priority for this year, but the two other priorities that we worked on are on my slide in front of you. So if you have questions, please feel free to answer or ask, and I will answer them. And our third big priority this year is Proposition 31, the flavored tobacco ban. This proposition would ban all flavored tobacco, including menthol. For more than 60 years, the tobacco industry has intentionally targeted the Black community and other communities of colors, hooking generations of Black youth on minty sweet menthol cigarettes and other candy flavored tobacco products, and profiting off addiction, disease, and death. In the 1950s, fewer than 10% of Black Americans who smoked menthols, but today, 85% of Black smokers use menthol cigarettes. This issue was originally passed by the legislature under Senate Bill 793 a few years ago, but Big Tobacco threatened the legislature with a ballot measure that would have limited their ability, along with the local government, from creating new taxes. So they were forced to pull the measure and have us revisit it through this ballot measure. We would like to acknowledge and thank the NAACP for their support of both Prop 31 and Senate Bill 793. Your partnership and support is critical, as we all know that Big Tobacco preys on your communities. And again, since we are running out of time, I would like to just say that the two other bills here are also examples of bills that we have worked on to reduce disparities and increase health equity. And so if there's any question, and also there's some resources at the bottom, some links if you would like to get involved. So I'm open to questions, and I thank you guys for having me here today to talk about the work that we're doing jointly and to hear about the work that you are doing on the ground. Thank you.
Well, thank you, Autumn. And these are great examples of when I talked earlier about addressing the issues at the system level. This is a great list of policies that are targeted to do that. And one of the things that we've been talking about, or I know we're going to wrap up, and I want to share my commentary, and then I'll pass it on to you and Pastor Rhonda to make some final remarks and the message that you want to leave with folks who are listening today. But one of the things that we have been talking a lot about lately and recognize is that when we think about why we're still talking about health disparities after the money that's been spent, the many years of focus and research and projects and so forth, programs are not enough. Programs can help, but that is not the solution to driving change. We know that we need to go beyond programs. and enact policies that can actually drive system, structural, and lasting change. So I would invite people to really learn more about how this process works and understand how you can amplify your voice and be an advocate for change for the Black community when it comes to not just cancer, but for other things that we need to make sure that we don't live in medical deserts or food deserts or under-resourced communities. We do have a voice and we can participate in the process to drive change that is about us, for us, and should be by us. So that's the message I want to leave with everybody today. And I'll turn it over to Pastor Rhonda to make some final remarks. And then Autumn, if you want to say a few last words before we wrap up today.
Thank you, Rhonda. So I'd like to leave you with this. To those who are diagnosed with cancer, don't allow fear to keep you from the resources that will help you get through the journey. Allow your faith, whatever it is, to know that help is present, help is available. All we have to do is connect you to it. So, and if you have trouble, feel free to reach out to Celebrate Life Cancer Ministry, and we will direct you to a place if we're not the place that will help you back. Thank you.
Sorry, I can unmute. Autumn, any final remarks from you?
Thank you all so much. Thank you, Rhonda. Thank you, Pastor Rhonda and Jen. I just want to say that if you're interested in more resources, I did display the resources. You can contact me directly, or Jen Meduco can get you my information. Please vote yes on Prop 31.
So Jen, I think you have some last minute things you want to share with everybody. And one question was, we can share the slides, so you have my slides already, so
yes.
Feel free to share them with the folks.
Yes, so I will share the slides with everyone, as well as some of the questions that did come up. And I know we are running out of time, but I did want to take just a couple of minutes to share some of the resources that are available, as well as some of the upcoming events through ACS CAN and from the California Black Health Network to look out for. They're both next week. So give me a second. So to talk a little bit specifically within ACS, if we're talking about access to care, there are a multitude of different resources that we do provide, but three things that I do want to highlight is our transportation resources through our Road to Recovery program, which is relaunching this month throughout the state of California. In California, we did have to pause it due to the pandemic, but we're really excited to be able to relaunch that this month, as well as for lodging. In California, we do not have a Hope Lodge, but we do have one in Hawaii, as well as our 24-hour call center that can answer any questions that you may have. So a little bit more about Road to Recovery. It's a service that we provide to allow pickup through our volunteer drivers for cancer patients to and from treatment. So that is relaunching this year. We are currently looking for volunteer drivers. So if you or someone that you know is available to volunteer for this service, we are definitely looking for drivers currently. And these slides with the information to tap into the service will be available, as well as our 800 number. That is 24 hours, 24/7. There's a live chat option as well. So if you have any questions about what you heard today or anything regarding cancer, diagnoses, treatment options, whatever you may have, our 800 number, cancer.org, are always resources that can help to answer all of those questions. Cancer.org is also available in different languages as well. The Cancer League Resource Center is also a amazing resource that's available to people. So if you're trying to navigate employment issues, your healthcare issues, government benefits, medical leave, estate planning, all the gambit that may come up when you are diagnosed. Those that you love are diagnosed. This is an amazing resource that's available that you can definitely tap into to help to answer some of those questions. And as Pastor Rhonda did mention, but in just creeping on the website, I do see that you guys have your monthly support fellowship gatherings that are virtual. That may be a great resource for people that are currently receiving treatment, people that are looking for community to just talk through these things. So I can definitely share more information about this as well as other things that she mentioned today. As I mentioned with Every Table, they provide really amazing, healthy, affordable meals. They have multiple locations through Southern California, and most of their meals really don't go above $5. So just thinking about food deserts, under-resourced communities, and knowing that you can provide really amazing meals for your family at $5, as opposed to looking at the other fast food options, those are definitely something that you hopefully will be able to not only take advantage of or share with those that you may know. I eat Every Table because the food's just really, really good. So I implore all of you to really check it out. And so much information has been shared today. So what can you do? Definitely just spread the word. This is being recorded. These slides are going to be shared with whomever that you may know. As I mentioned, Road to Recovery is an amazing resource for people because transportation is such a large barrier when it comes to access to care. So we are looking for drivers. So if you or others that you know may be willing to volunteer time to act as a driver as we are ramping up this Road to Recovery program, definitely reach out for more on that. And so many amazing organizations were mentioned today. So join ACS CAN if you want to get involved on the legislative side of things. If you want to find out more about the California Black Health Network, if you want to take advantage of Celebrate Live Cancer Ministries, if you aren't a member of your local branch of the NAACP but want to learn more about it, all of these things are available so that we can just spread the word about the amazing work that's being done. Mary Ponder did raise her hand. Yes, Mary, do you want to speak real quick?
No, I didn't. I was lowering my hand because there's something wrong with that particular part of my Zoom. No, but this has been very interesting, and I appreciate the conversation that you're having with everybody. It's very informative. Things that are happening that I didn't know that the NAACP was a part of, and it's very informative. I think people should take advantage of the information that you guys are giving, always giving out to the community.
Great, thank you so much. And just 2 more slides, and these are just about events that are coming up. So the 2 events that we really want to call out is on the 10th is the ACS CAN Research and Health Equity Policy Forum. That's going to be happening in partnership with Cedars-Sinai and UCLA Health. We have an amazing list of panelists, moderators, and others that involved. So definitely it's on the same kind of theme of access to care, because it's talking about research to reality and dismantling a lot of the disparities within the cancer care system, as well as the Black Health Agenda that's going to be happening in Sacramento County next week, August 11th, through the California Black Health Network. So both of these flyers are going to be shared after today if you're interested in checking any of those events coming up. And things to look out for: the 2022 state convention. So the California Hawaii NAACP 2022 state convention is going to be October 21st through the 23rd. So definitely keep the date in mind, and more information on that will be shared in the coming weeks and months. as well as the next training will be Wednesday, October 26th, 6 p.m. We might attempt to do a hybrid version of this, so look out for more on that. And since October is Breast Cancer Awareness Month, it will focus on breast cancer. So with that, arm yourself with the facts and resources, share with the larger community, and of course, definitely get involved. So thank you so much. And with that, I hope that everyone has an amazing night. Bye.